Speak sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com, Saffron vs Turmeric, which is better for depression. Break key takeaways. Saffron and turmeric reduced depression symptoms in studies, but further research is needed to determine which one is more effective. Small studies show that saffron is as effective for mild to moderate depression as some prescription antidepressants. While both spices may cause gastrointestinal side effects, turmeric, curcumin, may also cause liver toxicity. Break conventional antidepressants don't work for everyone and can cause significant side effects like sexual dysfunction and weight gain. When monitored by a healthcare provider, herbal supplements like saffron and turmeric may be options for some people with depression. Break saffron versus turmeric for depression. SaffronTurmericActive IngredientCrocin, crocetin, and safranalCurcuminEffectivenessWorked about as well as prescription antidepressants for mild to moderate depression may be similarly effective to fluoxetine, Prozac. Improved symptoms of depression and anxiety, reduced fatigue. Dosage 30 to 100 milligrams, mg, daily 500 to 1500 milligrams curcumin. Daily side effects: nausea, headache, dry mouth, reduced appetite, liver damage, gastritis, nausea, diarrhea, fast heart rate. Drug interactions: blood thinners, warfarin, antibiotics, cancer medicines, anti-inflammatories. Precautions: avoid during pregnancy. Avoid in people with liver problems, pregnant, or breastfeeding. Saffron versus turmeric for depression. What science says about mood-boosting benefits. Break. There haven't been any studies directly comparing saffron and turmeric, so we don't know which one is more effective for depression. Break. Research suggests that the active components of saffron and turmeric boost mood in several ways, including the following. Break. Increasing levels of chemical messengers, neurotransmitters, in your brain. Saffron and turmeric increase levels of feel-good hormones, including serotonin and dopamine, in your brain. Protecting your brain. Both decrease inflammation in the brain and spinal cord, which is associated with depression and other mental health conditions, for example, anxiety, schizophrenia. They also protect brain cells from damage by free radicals. Helping your brain adapt to stress. The components of saffron and turmeric may aid in forming new pathways that combat stress and regulate mood. Speak. There are several key distinctions between saffron and turmeric to consider if you are thinking of incorporating one into your daily regimen, including dosages and risks. Break. Supplements for depression. Break. Please avoid self-treating depression. And number 148, consult your healthcare provider if you experience symptoms. Supplements lack enough evidence to replace proven treatments like therapy and/or antidepressants. Break. How effective is saffron for depression? Break. Saffron, Crocus sativus, is a spice with antioxidant and anti-inflammatory properties traditionally used as a remedy for inflammation, lung diseases, and other conditions. Break. Several small clinical trials show that saffron worked about as well as conventional antidepressants, fluoxetine, Prozac, citalopram, Celexa, and sertraline, Zoloft, for mild to moderate depression. Break. It also reduced anxiety symptoms as well as the antidepressant class serotonin reuptake inhibitors, SSRIs. Break. More trials are needed before saffron can be routinely recommended. Break. How much saffron should I take? Break. Saffron has been studied for depression in clinical trials at dosages of 30 to 100 milligrams daily for up to 12 weeks. Break. Is saffron safe for me? Break. Like all supplements, saffron may cause side effects, interact with medications, and pose risks for specific populations. Please consult your healthcare provider before you use it. Break. Side effects. Saffron side effects and number 148, such as nausea, headache, dry mouth, and reduced appetite and number 148, are typically mild. Pregnancy. Avoid saffron during pregnancy due to a lack of safety data.Drug interactions. Saffron may increase bleeding risk and can interact with blood thinners like Coumadin, warfarin. Additionally, saffron interferes with some liver enzymes that break down medications, cytochrome P450 enzymes. Long-term safety. Further long-term studies are necessary to assess the safety and effectiveness of saffron when taken for periods exceeding 12 weeks. Related stories: what happens to your sleep, mood, and heart health when you add saffron to your diet? Soluble versus insoluble fiber, which is better for digestive health? How effective is turmeric, curcumin, for depression? Break. Turmeric, curcuma is a spice commonly used in cooking and employed as an herbal remedy for conditions such as infections, stomach pain, and arthritis. Break. Curcumin is the active ingredient in turmeric, which is found in its root. Speak. Curcumin, alone or as an add-on to conventional antidepressants, improved symptoms of depression and anxiety according to multiple clinical trials. However, many of these trials are small, and more research is still needed. There's very little data directly comparing turmeric or curcumin to conventional antidepressants. One small study found curcumin to be similarly effective to fluoxetine, Prozac. How much turmeric, curcumin, should I take? There's no specific recommended dosage for turmeric or curcumin. Curcumin has been studied in adults with depression at dosages ranging from 500 to 1500 mg daily for up to 12 weeks. Are turmeric and curcumin safe for me? Turmeric and curcumin may cause side effects, interact with medications, and pose risks for specific populations. For optimal safety, please consult your healthcare provider before use. Liver damage. Curcumin has been associated with liver injury. Symptoms to watch for include fatigue, nausea, jaundice, yellowing of skin and eyes, and dark urine. Stop taking curcumin or turmeric right away if you experience any of these signs of liver damage. Other side effects. Turmeric, curcumin, can also cause milder gastrointestinal side effects, including nausea, vomiting, and diarrhea. Precautions. Curcumin is not recommended during pregnancy or breastfeeding due to a lack of safety data. People with liver problems should also avoid it. Drug interactions. Curcumin may cause increased bleeding risk for people who take warfarin or other blood thinners. It increases the effectiveness of specific antibiotics, chemotherapy medications, and anti-inflammatory medications, and may increase the risk of side effects. Long-term safety. Due to the risk of serious side effects, such as liver damage, limit turmeric and curcumin use to a maximum of 3 months. Choosing a supplement. In the United States, the Food and Drug Administration, FDA, does not regulate dietary supplements the way it regulates prescription medications. As a result, some supplement products may not contain the ingredients listed on the label. When choosing a supplement, look for products independently tested or certified by organizations such as NSF, US Pharmacopoeia, or ConsumerLab.com. For personalized guidance, consult your healthcare provider, registered dietitian, nutritionist, RD or RDN, or pharmacist, RxCardClub.com. Get a free prescription drug /speak Road and save up to 80% on prescription drugs. /speak.